Welcome to the next in our series of the SDG impact of COVID-19. I'm very pleased to welcome Claire Melamed today, who is the CEO of the Global Partnership for Sustainable Development Data. Welcome, Claire. I would love to hear about how you are faring and if we could also learn a little bit about your organization.
Sure. Good morning, Marcia. It's nice to be speaking to you virtually from my study at the top of my house in North London. I think we're all getting used to a different way of working these days. The Global Partnership for Sustainable Development Data is just coming up to its 5th birthday. We were launched in September 2015. We were launched at the same time as the Sustainable Development Goals, as the partnership which was kind of created by the UN and by governments and by civil society and the private sector to help all of them come together, join forces to make sure that governments, that companies, that all of the organizations who were going to be part of achieving the Sustainable Development Goals had the data and the information that they need, both to plan what's the right thing to do and also to monitor our progress towards those very ambitious goals and whether we're on track to achieve them by 2030.
So I guess the most obvious question that I should ask you is whether you think that this could have been foreseen with better data. The situation that we find ourselves in now with this global crisis around the coronavirus.
I think, I mean, certainly I'm not neither an epidemiologist nor a public health expert, but I certainly, we were getting signals of a new, fairly, contagious virus in China, certainly very early this year. And there were people who were saying that this had the potential to spread widely and to cause the sort of disruption that we've seen. And of course, pandemic and the risk of pandemics has always been high on the list of risks that governments and international organizations worry about. I think there is a sense that it was only a matter of time. Of course, it's always hard, governments and multilateral organizations and always planning in conditions of uncertainty. One never knows. And I think there were signals. Some are now saying that they would have acted earlier. Others are still saying that some of the measures that are taken are too restrictive. It's an art, not a science, planning these kind of things. And while we absolutely have to be informed by the data, that's what we've got to help us make decisions. The data itself doesn't always point to very specific and obvious answers. It gives you the range of possibilities and scenarios, but these are still political and economic decisions that governments have to take about what is the appropriate response in different contexts.
And tell us about the Data for Now initiative that the Global Partnership for Sustainable Development Data has been behind.
Well, what's been really interesting about the data side of this current awful pandemic is the extent to which we're suddenly in a world where we're used to daily updates on death rates, we're used to daily briefings about the spread of the disease, and to having data which is almost instantaneous. Here in the UK, the government is reporting data from each day from the day before. So we're getting data which is almost sort of up to the minute on the spread of the pandemic. And that's exactly what governments need to be able to respond appropriately, to be able to see whether their policy measures are working, to be able to plan for the hospital beds and the testing kits and so on that are going to be needed. But having this sort of timely data and being able to rely on it is actually pretty unusual for most issues in the world and most countries in the world. And for the Sustainable Development Goals, certainly many countries are operating and planning and allocating resources on the basis of data which can be 5-10 years old. Of course, that's not a good situation for governments to be in, as they're working as hard as they can to achieve these very ambitious goals in just 10 years. So Data for Now really was conceived of before this coronavirus pandemic really hit us, and is very much about trying to make sure that governments do have the data that they need, the timely data that can help them to make the right critical decisions at the point at which they need to make them, rather than looking in the rearview mirror and seeing what happened 5 years ago. And I think, while this has absolutely come to the fore in relation to health measures and the importance of recording daily health data, the same is true of other things as well. We need to understand how the environment around us is changing, what's happening to air quality, what's happening to the coastlines and the soils upon which so much of our food production depends. So I think that the Data for Now was conceived as the answer to a problem that we don't have enough up-to-the-minute, up-to-date data to help governments to make the right decisions. And I think the pandemic and the data response to the pandemic has shown us both how important that is, but also how possible it is. When governments really decide that this is what they want, then they can do it.
What do you think the long-term impact might be of the coronavirus and the SDGs?
Well, I mean, yeah, who knows really? I think we're very it's a tempting invitation, but I think at this point any speculation about the long term is almost certain to be wrong. But let me just sort of point to some of the things. I mean, I think firstly, as I was just saying, this point about timeliness. We've got used to living in a world where we know what is happening as it happens in relation to health, and I hope that will inspire people to see that is possible, and that is the kind of information that we should expect for our policymakers to enable them to make the right decisions on our behalf. It's possible, and we've seen it, how important it is, and we should now expect that in other areas. I think that's obviously a very specific kind of impact around data and technology. I think over the long term, it's difficult to see how the impact of a pandemic like this, which has been this disruptive to economic and social life, really can be anything but very, very challenging, both for governments and for individuals to cope with. We've seen catastrophic impacts on economies around the world, and who knows how quickly those are going to bounce back, and what the impact on people's lives is going to be of that in terms of lost jobs, lost livelihoods. We're also seeing a whole sort of complicated range of interconnected social and environmental effects, some bad, some more positive. It's all happened so quickly. And the big unknowns, I think, are firstly how long it's going to last, and secondly how quickly our economies and our social lives are going to bounce back from that. And really, no one's ever seen anything like this before. So by definition, it's very, very difficult to speculate. But those would be the two key things I would look at: what's happening to the economy and what's happening to societies over the longer term.
So one of the things, if we look at other countries, South Korea is held up as a model for containing the disease more readily than other countries, and some of that has been put down to the fact that they tested very widely, but also that they had a very good tracing process that requires data. Is there a tension between what we in Europe, for example, or in the Americas are willing to tolerate in terms of digital privacy law, and what is needed in a pandemic like this?
I think there is, absolutely. But I think that the concern is, there's two concerns. There's about what is the intrusion into our privacy we're prepared to tolerate right now in return for a more effective pandemic response. And there, I think a lot of people would say, actually, in conditions like this, people are more willing to give up a certain amount of privacy, and more willing to accept those sort of technologies that can track movements and so on. But the real concern for people, I think, is what happens afterwards, is whether governments will have the kind of maturity and the self-control to give up on those tools, put the put the genie back in the bottle and say, no, we know we could use this to track people, but we won't do it. We'll put those back in the box. And I think that's the real fear, is not so much can those be useful now. I think there's a sense that, not at any cost, of course, but people are more willing to accept intrusions in their privacy if they can be demonstrated, as in the case of South Korea, to have an impact on the pandemic. But the fear is, will governments hold on, once they've been introduced, will they ever go back again? And I think that's the real danger here, that we'll find ourselves after the pandemic is over in a condition where our privacy is still being invaded, and the sort of personal surveillance of citizens is still higher than we would have accepted otherwise.
And have you come across any interesting innovations using data related to the crisis? And how has the work of the Global Partnership for Sustainable Development Data adjusted over the last so many weeks?
Well, I think like many organizations, we are in a process of real flux at the moment and trying to work out, what can we, as the kind of organization that we are, with the networks and the expertise that we have, what is the best thing that we can do to help in this sort of very frightening and challenging situation? And of course, we like everybody, it took us a little while to sort of understand the gravity, the seriousness of the situation, and the fact that this was something that was going to upend all of our plans and all of our work. And then to understand and discuss, as we're a network, our real value comes in bringing together groups of partners to do things and really helping to leverage the expertise and the and all of the sort of work of our partners and make that as effective as it can be. So that was really sort of where we started. Our focus right now is very much on trying to make sure that governments in particular and other organizations do have the data that they need to effectively plan for the pandemic. It hasn't hit in all countries yet. We work closely with a number of governments across Africa, and there, while they are seeing a few cases, they're not seeing the same level of illness as we are, say, here where I sit in the UK. But of course, there is a sense that it's likely to be coming, and governments have to be prepared. So we're working with governments in Africa to try to mobilize the resources and the partnerships that will mean that, as of course they scramble to make sure that they have the technologies and the resources and the drugs and the ventilators and all the things that they need, we are, as our small piece of that huge effort, trying to make sure that governments also have the data and the information that they need to be able to use all those resources effectively. You need to know where to put the ventilators, where the people are who are most likely to get sick. So we're trying to help them to put together, to understand, where are the populations that are most likely to get sick, where are the more elderly people, the people with particular pre-existing conditions concentrated, where are the health infrastructures, where are all the health clinics, what's the quality of the roads that will get people to the clinics, where are the bridges down, so it's going to be particularly difficult for people to get to the clinic, things like that. Trying to get governments in a situation where they're easily able to respond when the pandemic does hit and know what to do. And then also trying to set in place the systems that will mean that they can track the health effects and the social and economic effects. So we're mobilizing all of our partners. That has taken over a huge amount of our work. It's very much in the spirit of the Data for Now initiative. It is absolutely data for now, because now is, and now for many countries is all about the pandemic. In terms of innovations, there are obviously a huge amount of innovations in the area of data already, and things that have been tested and shown to work. And we're really focused on getting the things that we know work and putting them immediately to use. It's not enough just to have an innovation. The innovation has to actually reach the person or the government department or the NGO who needs it, and then they have to understand how to use it, and then they have to actually start to integrate that data into their systems for decision making and so on. So there's quite a lot of steps between having an innovation and actually that innovation being used to save lives in this pandemic. And we're really interested in identifying where those particular solutions lie, but making sure that we kind of work right along that chain to get the data to where it needs to be and actually make sure it's being used to save lives.
So I have been interested in how the data that we are collecting on COVID-19 can inform the data that we need for understanding progress on the SDGs. Do you think that this rush of daily information and the primacy of data in this crisis will have a positive influence on the availability in the future of data for the SDGs?
I think it might well do. I mean, of course, our priority and everyone's priority now is focused on the short term and in getting countries and, you know, health authorities and everybody who needs to have it, the data that they need to do the best job that they can right now. But absolutely, we have a responsibility. I think there's a lot of resources are going to go into this, and we do have a responsibility to do that with an eye on the longer term. And how can we make sure that as we do things to support countries in this moment and for this urgent need, we're doing that in a way that does support sort of longer term data systems. So we make sure that people are being trained to use these new types of data as we go. We make sure that this integrates well into government systems so that it can be used over the longer term, so that governments can continue using some of these useful tools once the pandemic is over. And absolutely, I hope that we'll come out of this crisis, first of all, that it, you know, will be, the severity of the crisis will be reduced by the good use of good data, but also that we're going to come out of it with stronger data systems, with people who are better trained and to produce data and to use data, and as you say, with a kind of increased awareness of how data is a really important part of the infrastructure for government policy making, and is something that sort of everyone who cares about social progress and results needs to care about the data that can underpin the successful action to achieve those things.
But in some ways, I've been surprised at the lack of data that seems to me should have been in existence already. An example is the changing views, or what seems to be a changing view on the use of masks by the general population. So the World Health Organization is now looking at whether they want to change their guidance. Initially, it was for healthcare workers on the front line in hospitals and helping with those that are sick and infected with the virus. But now it seems as if there is a change in perspective, that maybe more data is being looked at to say actually it might have a deterrent effect, even if not highly effective in all circumstances. It may have a general positive influence on kind of redirecting molecules, etc., that may be generated from a sneeze or a cough. And why didn't we know this already?
I know, it's so interesting really watching policy evolve in response to the data. I mean, I think we didn't know this already because we didn't know it, because this is a new virus. And I think people are, you know, and this is really the importance of having data in a sort of as close to real time as we can get it, because policy is evolving as our knowledge about the virus evolves. I mean, the same thing, you know, I think the other thing I've really noticed is how our understanding of what are the underlying conditions that make the virus most dangerous to people has also evolved. You know, is it respiratory conditions? Is it's pre-existing heart conditions and so on? And I think there's all kinds of ways in which our understanding of the virus is changing as more and more data is collected and analysed, and how that is leading to a change. And in some ways, I think we should be glad that sort of governments are transparent and adaptive enough to cope, to sort of be able to acknowledge that perhaps, you know, their understanding is being updated. They didn't know everything at the beginning, and they're going to be changing their advice as the facts change. And I think that's exactly what we should be wanting from our sort of public bodies at this time. We want them to have the data, and we want them to use it and be prepared to kind of adapt their messaging in line with that. So, you know, in some ways that's kind of, that sort of absolutely shows the importance of having real-time data, and also the importance of it being used in this sort of transparent way. And I think that's so important for building up public trust. You know, the sort of our responses to those public messages about the use of masks or whatever will depend on how much we trust the governments that are giving us that advice. And I think they need to sort of show their workings for us to trust what they say.
You have a very interesting project that you were planning to bring to fruition in the autumn. Tell us about that, and if you think that might still go ahead.
Thank you. Yes, we are. We've been working with a number of different groups to launch the SDG data clocks in the autumn. As you say, we are somewhat, like everybody, working through the timing of that. So I can't promise that the clocks will be unveiled in the autumn, but we're definitely going ahead. And the intention with the clocks is to provide data for advocacy groups, for those who really focus their energies on advocating with governments for the kind of policies that will help us to achieve the Sustainable Development Goals, and keeping that very ambitious agenda at the forefront of government policy making. And the clocks really are intended to do for a whole range of SDGs what this real-time data on the pandemic is doing for us in this current situation, to really concentrate minds on the changes that are happening now, the trajectories that we're seeing now, and the kind of action that we as citizens have a right to demand of our governments to change, you know, to bend those curves towards the Sustainable Development Goals. So just as we're seeing the kind of daily real-time data on the COVID pandemic, the clocks are going to be showing us real-time global data on other really key issues around women's participation in politics, around the state of our environment, around hunger in the world. So, you know, the kind of data, up-to-date data that we've come to expect from this on COVID and from this pandemic, we hope will also soon be available on the kind of other issues that people really care about and that can most affect people's lives. So can't swear to you that it's going to be in the autumn. Like everybody, we are trying to work out what's the sort of best and most responsible use of our resources now, but absolutely we're still committed, if anything more committed, to the importance of the clocks and getting that timely data out to people so they can see the reality of what's going on in their world and demand that governments act on it.
My name is Marcia Beliciano, Global Head of Corporate Responsibility for RELX, and I would like to thank Claire Melamed, Chief Executive of the Global Partnership for Sustainable Development Data, who oversees the Data for Now project. Claire, thank you so much for your insights. We really appreciate them.
Thank you. It's a pleasure.